Hello and welcome. My name is Nancy Berry. I'm the Marketing Manager for Rosewood Centers for Eating Disorders and your host for the Rosewood Institute webinar series, Religious Dietary Practice Considerations in the Treatment of Eating Disorders. Joining me in the studio today is Helen Pack, Dietitian Adult Services. We will have time at the end of our presentation for questions and we'll give you the contact information then. Right now, I'm going to turn this over to Helen. Welcome, Helen.
Thank you, Nancy. So today's objectives include a brief discussion of the importance of religion or spirituality in treatment and recovery from an eating disorder. The most common distinction between religion and spirituality is that religion tends to incorporate public rituals and organized doctrines, whereas spirituality tends to be more personal and private. I'll present some reasons for and examples of religious dietary practices, as well as note some similarities between devoted religious followers and persons struggling with eating disorders. I do have some case studies that I wanted to present to you, as well as offer some tips on working with clients with eating disorders. So when I started working in the field of eating disorders, I quickly learned and very much agree that there should ideally be three components to treatment and recovery from an eating disorder. The first one includes the physical or medical component, which includes medical doctors, psychiatrists, dietitians, hopefully working together to help decrease a client's risk of medical complications and improve their health overall. This may include monitoring their lab values, their vitals, prescribing medication, of course weight restoration, as well as prescribing meal plan and making adjustments. The psychological component includes therapists who help clients let go of their eating disorder and provide tools and healthy coping skills. And lastly, and many professionals believe that a higher power increases the likelihood of recovery. Personally, I feel like some of the most successful clients that I've worked with do have a spiritual component to their recovery that's really helped them stay motivated during treatment and have the courage to battle their disorder. So upon preparing for my presentation today, I was amazed to learn that there are over 750 million individually identifiable religions in the world today. Many are different denominations of the same religion, but nonetheless, I think that's pretty impressive. In working with clients practicing different religions, it's very often that when I ask them, why they practice certain food restrictions in their religion, their answer is simply because the Bible says so or because the Torah says so. And so something that I share with the clients and I discuss with them is that many religious customs and laws can be traced to early concerns for health and safety in consuming foods or liquids. Back in the day, there was limited preservation techniques, no electricity or storage, and it was an attempt to prevent spoilage and disease prevention. So many different religions came up with their set of specific laws about what can be consumed, and fortunately or unfortunately, a lot of these laws still remain in practice today. So sometimes just discussing this with the client and asking them, would your higher power want you to be in harm's way? Because when it boils down to it, it's for your health and safety, and right now you're not healthy and you're not safe. So sometimes it just gets them, it starts a dialogue to make them start thinking about prioritizing or reprioritizing what foods they do incorporate into their life. With some religions, such as Buddhism, it's an attempt to consume just the purest foods. Other religions like Hinduism, it could be an attempt to avoid eating or consuming sacred foods. So vegetarians, I would say that among my 12 years of working, specifically with clients with eating disorders, about a third of clients that I work with are or have been vegetarians at one time or another in their life. And some religions such as Seventh-day Adventists, Hindus, Buddhists, and Rastafarians, do practice vegetarian lifestyles. And there are different degrees or types of vegetarians, the most strictest being vegans, and vegans eliminate all animal products. And just in nature, even clients or people that are vegans without eating disorders, they tend to have a preoccupation with food. When I go to restaurants with my vegan friends, it seems like there's an average of 7 questions that have to be asked before they finally place their order. So for a person with an eating disorder that is vegan, it even increases that preoccupation even that much more. There's lacto-vegetarians, vegetarians that incorporate dairy. There's ovo-vegetarians, vegetarians that incorporate eggs. So of course, lacto-ovo-vegetarians incorporate both dairy and eggs. And the last type of vegetarians that I do still consider vegetarians are those pesca-vegetarians that incorporate fish or shellfish. A lot of clients with eating disorders, they really hold on to having an identity or label, a label of having an eating disorder, Jane with anorexia. So that sometimes that goes the same with vegetarians, and I don't really consider pollo vegetarians, which are basically vegetarians that incorporate chicken and everything but red meat. But again, some clients really do hold on to that identity, and at first I don't question them because when it boils down to it, I know that they will and can be very healthy and have their protein needs met, but it's very interesting to note. It's also very important, I think, to note the timeline that the client decides to become a vegetarian and when their eating disorder begins. Very often within the population I've worked with, I would say that a large majority, it does coincide within a year when they become vegetarian and when they develop an eating disorder, or vice versa, when they developed an eating disorder and then decide to become vegetarians. So upon our initial meeting, I begin to evaluate the client's individual's motivation to become a vegetarian. And huge yellow warning flags is if it's an attempt to lose weight, or to practice self-discipline or self-control. I've noticed that a lot of clients that are go through a vegetarian phase, it happens during their teen years, where I think, again, it could involve that self-discipline, whereas with clients in college, that's when they really, and in their 20s, that's when they may become vegetarians as an attempt to lose weight. So my first case study involves a 35-year-old male yoga instructor from Berkeley, California, who was diagnosed with bulimia 8 years ago. He's been a lacto-ovo-vegetarian, so he has dairy and eggs for quote, as long as I can remember. He is Seventh-day Adventist, and his parents are also Seventh-day Adventists and raised him and his siblings as vegetarians. When I asked him about his protein sources, it includes eggs, all dairy, tofu, soy products, beans, quinoa, millet. He had a very extensive list of foods that he did eat regularly. The patient was also within his ideal body weight range, so weight restoration was not a goal, and his lab values came within normal limits with no history of anemia or B vitamin deficiency. In this particular case, I didn't really waste much time trying to convert him into eating more animal proteins, because he did have a lot of adequate sources of protein. Instead, I focused most of our sessions on the behaviors and trying to minimize the behaviors and the thoughts around the eating disorders, and just get him to follow a healthy meal plan for him. Now in this case study, the second one, it involves a 19-year-old female who was diagnosed with anorexia nervosa at 14 years old. Upon interviewing her, she decided to become a vegetarian at 13 after watching a documentary on slaughtered animals. This is something very common that I see. No religion is identified, and when I was asking the patient of her food preferences and a food recall, she dislikes eggs, tofu, and soy products such as veggie burgers and chickenless nuggets. Her fear foods include regular cheese, nuts, and nut butters. She is a severe calorie counter and avoids drinking calories. She knows the calorie contents of everything. So even she would avoid milk and drink soy milk to a minimum. She did drink almond milk or rice milk to begin with, and because of the protein that she needed, she did switch over to soy milk. And when I asked her about her protein sources, she really struggled to think of anything that really offered a significant amount of protein. She did eat beans, but that came out to about once a week. And she did eat whole grains, although that was a fear food as well. The patient needed to restore around 30 pounds when I first started working with her, and her labs indicated iron deficiency anemia. And as we built trust, she was able to admit to me, it was really hard at first to admit binge eating behavior, and she was very shameful, but she was able to admit that she does binge eat on fast foods and does eat burgers and fries when she does binge eat. And so this again was a huge red flag that this client was not following a vegetarian lifestyle for the right reasons being ethical or possibly religion, but she was doing it as an attempt to really restrict the foods that she does incorporate into her diet. So with her, it was slow, and at first, I did try to honor the vegetarian lifestyle, and I encouraged her to let me know what protein sources she wanted to integrate. And, when she was stumped, and I would educate her on why protein was important, and so she eventually decided to eat chicken and fish, and then she added turkey, and she still does not eat red meat. However, her health became a lot better when she was able to incorporate some animal proteins. So many religions, they don't necessarily eliminate all meats, but they do eliminate specific proteins, such as Hinduism. Beef is primarily prohibited, and some Hindus also avoid meats and fish. Islam, pork and certain birds of prey is prohibited. Eastern Orthodox Christianity, restrictions on meat and fish. Roman Catholics, meat is prohibited on certain days. So with these population, it is still fairly simple to have all their protein needs and vitamin mineral needs met, because it's only one or two meats that they eliminate. So this one isn't as problematic even at the inpatient level to work with. Now, I would say that the most challenging population are Jewish clients that do keep kosher. Kosher is the method of processing food according to Jewish laws, the Torah. So the reason this can be very challenging in the inpatient level is not only does Jewish law include foods that can or cannot be eaten, it also defines how these foods must be prepared and eaten. For instance, pork and shellfish is prohibited. Red meat is okay and dairy is okay, but it is prohibited from being eaten at the same time. Leavened food is restricted. As utensils that have come in contact with non-kosher foods may not be used. And so with this population, like I said, the first thing I would do is have these clients tell me how they practice being kosher. I don't want to give them any ideas. I don't want to ask them if utensils is a factor or whatnot. I let them let me know what they are willing and not willing to do. And the next thing that I do recommend is trying to interview or have their family involved, because again, it's very often that the family doesn't keep kosher or are not as strict, but the client, when they come into treatment, as an attempt to really control what and perhaps limit what they do eat, they will all of a sudden become extremely kosher. So this is an example. My next case study is a 17-year-old female with anorexia nervosa with purging, which is a more compromised population because they're underweight as well as engage in self-induced vomiting or other compensatory behaviors. She came in after an intervention from family and friends, so there was a huge resistance and denial of the eating disorder, and a very limited motivation at first to get treatment. And so when I read the intake, it didn't say anything about a kosher lifestyle, but the patient, when I did interview her and meet with her for the first time, she adamantly stated that she was kosher and could only eat kosher meats, that she had a huge list of things that she did follow, or she claimed to have followed. This patient, her lab value, she was so severely anemic that she was to the point of needing blood transfusions. So for this client, meat and red meat was a very good source of heme iron to help improve her anemia. So there was a release of information from her family, and because it was an intervention, I knew that the family did have some say and involvement with the client. So I did speak to her father, who basically said that she does not keep kosher. The only thing she followed was not eating pork, and that's the way she was raised. So I brought the client in with and had a phone conference with the father. And although the father was a little bit harsh, after our meeting, she was willing to be more compliant and eat more foods. I did have one severe, or I guess I should say devoted, kosher client who did really practice. He was in his 40s, so he had a maturity that I did believe that was legitimate, his kosher lifestyle. And so with him, nowadays it's pretty common to have very different ethnic restaurants as well as stores. So we're able to have his food cater, and we did find a compromise that worked for him. So we're able to treat him and help him recover from his eating disorder. So with every religion that I personally worked with and researched, religious leaders do recognize that exceptions should be addressed within their congregations. And so basically it boils down to group members that are at potential high risk should not follow or do not need to follow food restrictions. This includes pregnant or nursing women, individuals with chronic disorders such as diabetes, individuals engaging in very strenuous work, malnourished individuals, young children, and frail, elderly, or disabled persons. So this is, again, something that I can bring up to the client, that an eating disorder is, they're basically malnourished and they do have a chronic disorder. And so sometimes, a couple of times, I actually had the rabbi or the priest on the phone to really confirm to the client that their health and well-being superseded their need to follow that food restriction. So that is another tool that I feel is very helpful. I did want to point out that there are some similar characteristics between clients with eating disorders and devoted religious followers. They tend to be very black and white. It's all or nothing. It's good or bad. They tend to have a compulsive personality, so this could involve food as well as cleanliness or the handling or cooking of food. There's an inflexibility or rigidity potentially, that, I have to eat it this way, or I have to, follow this every time I eat. So that also it can be an eating disorder, and a good way for religious followers to hide behind their eating disorder. And they tend to be very ritualistic, again, with their food, their meal planning, their meal preparation. So again, as much as we try to promote, and I do encourage honoring your client's spirituality or religious beliefs, it's a very convenient way to hide their eating disorder. So in working with clients with eating disorders, with religious restrictions, the first thing I recommend is really trying to pick and choose your battles. At first, the most important thing as a dietitian, I think, is establishing trust with the client. And, when you call them too quickly on stuff, then you're going to get a resistance. So, again, at first, as long as they're getting their protein needs met, as long as they're getting the vitamin and minerals somehow, I try to really acknowledge and honor the lifestyle that they want. And then as they have more education and I get more proof, such as labs or inability to restore weight, that's when I will, confront the patient about, helping me to help them. I encourage you to continuously explore and revisit their motivation to restrict certain foods. Like I said, they may say at first that it is for religious reasons and could be very adamant to continue it, but as they're more invested in their health and recovery, they might be able to admit that it's more motivated or driven by their eating disorder than because of their religious practice. And whenever possible, get family members or religious leaders on board. Again, it's to emphasize that it's to better their health, and sometimes they have a lot of guilt in not following the food restrictions because of the way that they're raised or because their family members follow it. So trying to get their family members to let them know that it's okay, your health comes first, is very helpful. I try as much as possible to be creative and present realistic options with meal planning to help meet the client's needs. I try to work with the patient, get their input, and help them feel like they're part of a team by letting me know, okay, what are you willing to do? What are you able to do? And in the inpatient level, if weight restoration is a priority and it's taking them some time to come around, then, you know, supplementation is sometimes very necessary and helpful as well. So this, I think I'm ready to try to get some questions.
Okay, great. Thank you so much. I appreciate that information, as I'm sure our guests, our attendees do as well. I've put up a slide with Sylvia Gargan's email address. If you have any questions, please feel free to send those to us, and we'll start with one that I came up with just as I was sitting here thinking about this. Do you honor fasting for religious reasons during treatment?
Oh, that's always a tough, tricky one. I've had phone calls and inquiries about whether or not we would honor fasting. And, you know, again, within different religions, they fast at different periods for certain different lengths of time. However, it is not okay. And this is where, you know, whatever religion they are, this is where I would get their religious leader on the phone if possible to talk to them and be involved. Of course, I would get a release of information. And many of these clients, I would say all of them that have come to treatment have agreed not to fast during the time. So again, my whole point is that you need to be healthier so you could do everything in life you want to. And, you know, again, focus on your health first, and, you know, maybe next year or the year after that, you could participate in a fasting ritual.
Okay. Well, here's our first question from the audience. Is it always appropriate to consult the family if the patient who reports many religious dietary practices is an adult?
Yes, I think so. This is definitely, if you are able to get a release of information, it is very helpful to interview the family, even though they are adults, because then, if anything, it helps you understand the family dynamics and how they've come to, you know, to believe certain eating disorder beliefs. So I definitely encourage it to try to get a release of information and talk to the family members to see where the client, how the client was raised and where they're at.
Would it just be like the parents, or would you even talk to siblings during that?
Sometimes it's siblings, sometimes it's parents, and like I said, sometimes clients are okay with signing a release of information for their rabbi or their priest or whatnot. So it's very helpful. To me, I feel like it's all pieces of the puzzle. Okay. So as many people as you can get involved, the more helpful it is.
Okay. And we have another question. How do you handle a patient who wants to observe Lent?
Oh, this is actually a fun one. And I was raised in a Catholic school, so I think definitely with this population, it is very workable, and you could almost use their desire to observe Lent to help them with their eating disorder by having a non-food item, by having them give up a non-food item versus a food item. I don't know where it started, and I remember in middle school, we used to give up chocolate or something. But with the population of eating disorders, I encourage them to give up, looking in the mirror or negative fat talk, no fat talk for that period of time. This, again, it could be a variety of things, giving up alcohol or cigarettes or something to improve their health, or having to say a positive affirmation. So the list is endless as far as what you could do or encourage the patient to give up for Lent, but definitely I don't encourage it to be a food item.
Okay, and let me see here. We needed another question from the audience, maybe? Okay, it looks like we don't have any more at this time, so I'm going to move forward and just show you what's coming up next month. On November 13th, we will have Hunter Taylor, the clinical director of our adult services, presenting on Living Out Loud, Psychodrama for Recovery. He's going to attempt to walk us through what psychodrama would look like, even though you won't be able to see him actually participate with psychodrama. We want to thank each and every one of you for taking time out of your busy days, and we do hope you enjoyed this webinar series. If you have any additional questions, please feel free to continue to send in your emails, and Helen will forward those to Helen and make sure she gets back to you. Thank you again, Helen. We appreciate your time.
Thank you.